for a second, you got to go back and look. And the other one shows similarly. Next, please. So I would beware of claims of improvement. Even if there are improvements made in the workflow and the EMRs or whatever, my fundamental question is going to be improvements to what end? Which model of healthcare are those improvements serving? Are they serving an industrialized healthcare model, or are they serving an actual delivery of healthcare model? Because they may very well be improvements, but that kind of gets back to this concept of outcomes. One thing that's not realized, and again, I'm trying to promote understanding, because there is a lot of difficulty for everybody in healthcare at every level, and that does include administration. I'm not excluding them. There are things that they really get screwed on that then trickle downhill. But in the provider's practice, we really have 2 or even 3 simultaneous patient panels. So we have the one that's on the schedule if you're in the clinic, and your inboxes, electronic or paper. And I took a screenshot. Next slide, please. This was back in 2018 when I was still in the clinic. You notice in my inbox I have 178 documents to review. Now I would note, those are not single-page documents. Any one of these documents could be a scanned file from Virginia Mason from a discharge. It could be 47, 72 pages long. It could be a new patient. It could be 150 pages long. It takes time to go through that. There could be hidden in there some little nodule in a lung that nobody was looking for, and then years later, oh, it's cancer, how could you miss that? Well, I tell people, well, it's in the record. Yeah, things are in the encyclopedia too, but I don't have time to dig into it. Next slide, please. So, providers in general, no time to think, let alone to explore. I'd like to read a quote from a journal from a clinical epidemiology rounds that said that as nearly as we can tell, everybody's behind in the reading, and well, we should be. To keep up with the 10 leading journals in internal medicine, you've got to read 200 articles and 70 editorials a month. There are now over 20,000 different biomedical journals, and to read up on viral hepatitis requires selection from among 16,000 citations published on this topic in English alone in the last 10 years. Next slide. And it talks about the expanding of the literature. Any guesses on when this was written? Next slide. 1981.
Wow.
Okay, now we do have better access to data now with the internet and so forth, but the volume of data has also expanded multiplicatively, if not exponentially. So the net effect of this, regardless of the intentions of anybody in the process, the net effect of the system is that providers are disincentivized and even penalized for spending time thinking, spending time with patients relationally, and practicing real medicine rather than industrialized healthcare. And it is a self-perpetuating, self-promoting, I would say self-protecting system, regardless of the efforts of many within it to fight that. So I thought we could sum it up by looking at what Gordon Guyatt himself says. I think that the one who coined the term evidence-based medicine, the model that we're all supposed to be following, what the system should be accomplishing if we're actually even getting close to our goal. What did Dr. Guyatt say? Well, this is back from December. Next.
Sorry.
Oh, you're fine. He tweeted this in response to an article that came out in the British Medical Journal in December, just published in the British Medical Journal. Uniquely eloquent depiction of industrialized healthcare, increasingly dehumanized, transactional, generic, burdensome, and cruel, delivered by morally injured, burned out, and spent clinicians, humanly unsustainable, solutions offered. That's stark, but that's coming from the mouth of the man who was at the forefront of championing this paradigm. And I thought this is very interesting, and this deserves more emphasis, but this was a poll from late 2022 and early 2023 where they had different clinicians, so physicians, nurse practitioners, CRNAs, physician's assistants, and clinical pharmacists. The pattern here is incredible. Only 12 to 14% consider themselves not overworked, and the percentage that are looking for other careers, 16, 19%, 18%, 17%, this is amazing. I mean, people that have spent decades in this or have done their training and said, screw this, I'm not going to do this. But those figures are sobering, and I bring them up because if people act on this, and obviously they're thinking about it, there's just going to be more of a dearth of healthcare providers. So next please. All right, accountable. How can we hold them accountable in helping us feel and function optimally as long as possible? Well, next slide. We learn how to become an evidence-based patient. Now, I'd say, first of all, when I talk about accountability, I think it's very important that we all look at ourselves. Everybody in the process has a role in this. So, first of all, I think it can be daunting at first, but to take healthcare back, the responsibility for it into our own hands, is absolutely key. Next. And this is where, next please, the 4 non-blondes get informed. Scream at the top of our lungs, what's going on? And we need to dig deep. And that's set resources for further study. And one thing that I would want to note, lest anybody say that I'm overstating the case here, the people on that sheet, I deliberately chose them. There are a number of senior editors or editors-in-chief for the top medical journals in the world. Now, why they're not being listened to is beyond me, but it's very sobering. If you go back, please. And then I have to tell myself, because it's taken me quite a while on a number of things in life, including healthcare, to be willing to believe that things are as bad as they really are, but we can't treat something if we don't have an accurate diagnosis. I don't want to overstate it, but I certainly don't want to understate it. Next, please. So now the Leatherman. Next. The Leatherman, as you probably know, a multi-tool. It doesn't do everything, but what it does is pretty amazing. Once I got one, I don't know if I can use this thing, and then I find I can use it for just about everything. A few simple tools. It's portable. And the same thing with evidence-based medicine. These are actually tools and concepts that we use in our daily lives all the time. To me, that was such a revelation. It's just a matter of learning how to apply them to healthcare and what they're called. Next. So the benefits. Well, one thing, we can collaborate with our healthcare providers and synergize, if that's a word. I prefer the approach to medicine. I tell people I want a collaborative approach. If you've got things that you've looked up, let's talk about it. You may have ideas. I may have missed something. You may have a perspective. What you say may be incorrect, but it may send me in the right direction. And I think, we all appreciate that. We begin to critique our own thinking. And by the way, I put together a patient's guide to evidence-based health choices that you all should have gotten to help get us on our way. Understanding just how broken and corrupt the system is, I think should also help us to be more compassionate. And finally, when it can't be bullied or manipulated as easily by that system. I told Dr. Guy a number of years ago when I was at one of his workshops, I said a big reason why I'm doing a deeper dive into EBM is I don't want to be pushed around. I'm tired of it. And what I have found is that you learn these tools and suddenly we're all on a level playing field, and that's just great. Because that'll help me as a provider, it'll help the patient, and then we're working together. So what is a technical definition of evidence-based medicine? The application of the best available patient-oriented research to clinical care, which requires the integration of that evidence with clinical expertise and patient values. It's not just about randomized, controlled, all of that trials. That's part of it. But it requires these 3 things. That's from the British Medical Journal. Next, please. So this little cartoon from a short video online, I think captures it well. You've got quality, relevant evidence, the patient's values and preferences, and the physician's judgment and experience. Next. So the question arises, haven't they always used evidence to practice medicine? I mean, what are you talking about? Well, it depends on what you mean by evidence and what emphasis it has, the external evidence, how it was critically appraised. Before 1990, there was a much different role for an emphasis on clinical research. If you go read anything or look at Dr. Guyot's lectures on YouTube, he illustrates this very nicely. And much depended on expert opinion, established practices, and so forth. So next. And the first time I met him in person, Dr. Guyot said this, and it kind of blew me away. EBM at its heart is about challenging authority. Now, he doesn't mean a knee-jerk kind of challenge, but really accountability. It's not disregarding expertise, but challenging it. So he coined in 1990 this term to describe the emphasis and really a different paradigm of practice and teaching that they were doing at McMaster. And it embodies 3 principles: that some evidence is more trustworthy than others, and there needs to be guidance as to what's trustworthy. This middle one really is going to be more if you do a deeper dive. And evidence by itself is never sufficient. Decisions require consideration of patient values and preferences. Now, I don't ever remember having a lecture on that in all my residency, and yet that's one of the 3 principles, not just he, but he's got articles on this he shows in his talk, this talk right here. Next, please. So I also like to break it down into tools and telos. I think tools is simple enough. Those are the things that we use to analyze and apply the evidence. We're going to learn a couple of them here. The telos is a Greek word for goal or end. The goal that we're supposed to be aiming at and using the tools. Now we get back to our definition of health. The end of a thing, or its ultimate goal, is its perfection. Next. So there are differing strengths of evidence, a tale of 2 guitars. So next slide. We're going to just hear about 4 seconds of a world-class guitarist who's one of my favorite musicians. Okay, so Phil Kagi, I can get an idea from 5 seconds that this man is highly skilled. Next slide. So, a tale of 2 guitars. There are 2 aspects of how a guitar can sound when it's played. The intrinsic quality of the guitar and the skill of the musician. Next, please. So, a $90 beginner guitar can produce music, but it doesn't sound so great. But a $10,000 master level guitar can produce amazing music. So Phil Kagi on the beginner guitar, he's going to sound good.